fissure has number one, chorda tympani, which is exiting towards under the base of the skull. Number two, there is a branch from maxillary artery. There is a branch which is called anterior tympanic artery. What is it? Anterior tympanic artery. It goes into tympanic cavity to supply the middle ear. And there is a posterior auricular artery here. And from the posterior auricular artery, there is posterior, yes, stylomastoid artery. And stylomastoid artery, as it is going upward through the posterior canaliculate, it gives a posterior tympanic branch. So there is anterior tympanic artery and there is posterior tympanic artery. These are the two major blood supply to the middle ear. There are other small branches we can ignore, but these two branches should not be ignored. The middle ear is supplied by anterior tympanic artery and also from posterior tympanic artery. Anterior tympanic artery is coming from maxillary artery and it is entering middle ear through petrotympanic fissure, right? And there is posterior tympanic artery, which is the branch of stylomastoid artery, which is itself a branch of, what is this? Posterior auricular artery, which is itself a branch of external carotid artery. And of course, no fun in telling external carotid artery the branch of common carotid artery. Okay? So, now, how many features in the anterior wall? Number one, canal for tensor tympani. Number two, opening of eustachian tube. Then there are openings for different neuronal system. Number one, lesser petrosal nerve exits through anterior wall, right? Then there are sympathetic fibers, corticotympanic nerves which are coming into tympanic system, and then chorda tympani which is moving through the anterior wall and exiting under surface of the skull, base of skull through petrotympanic fissure. Any question up to this? No. Now I would love to go into detail of this funny thing, eustachian tube. It's clinically very, very, very important, right? So let's go into detail of eustachian tube. Okay, it is worth drawing a new diagram. Now, I will show you eustachian tube in at two angles. Number one from the side, if we make a section like this. Number two from the front, if we make a section like that, right? First from the side. It is the same diagram as posterior. So I will just make anterior canal fossa, middle canal fossa, and your beautiful nose, and your tongue, soft palate. Okay, and what should be here? This is of course orbit. And what is here? Pharynx. What is this? Pharynx, right? Now, actually, now this is middle canal fossa. Here was your middle ear, right? From middle ear anterior wall, as I mentioned previously, this tube was, upper tube was canal for tensor tympani. No, tensor tympani, yes. This tube was exiting from this area, right? And it is moving actually forward and medially. So I should make it a little more superior. Yes, here. This is the middle ear and this is its anterior wall, right? Now from its anterior wall, eustachian tube move forward and 30-degree downward and 30-degree downward, and it opens into lateral wall of nasopharynx at the level of inferior nasal meatus or at the level of inferior nasal concha, right? If you don't remember anything, at least you should remember that this tube, which is called pharyngotympanic tube. What is this called? Pharyngotympanic tube. This pharyngotympanic tube extends from the pharynx, nasopharynx, to the middle ear cavity, and if you trace it from the middle ear cavity, it moves 30 degree downward and 45 degree anteromedially. Let me tell you, if I'm standing like this, and this is my eustachian tube, okay? If this is my eustachian tube, right? This is the middle ear, here is my pharynx, and there is the nose. Now it is not going directly forward, no. It is number one, 30 degree downward. Number two, very important thing, it is also 45 degree medially. So it means, if, as you know, there are two eustachian tube, so one right and the other left. First, for simplicity, I show they are going forward from both ears, going forward. Actually not forward, they are going little downward, and 45 degrees medially, anteromedially. And here both of them open into nasopharynx on the back of the nose. Is it clear? Now, this tube, its initial 1/3 is bony. Its initial 1/3 is bony, right? And it's on the pharyngeal side, last 2/3 is, you can say, cartilaginous and some fibrocartilaginous, right? On the pharynx side, pharyngeal side, right? In distal, on the pharyngeal side, it is fibrocartilaginous, right? It is about, in adult, it's about 3 centimeters. So we can say 1 centimeter with the tympanic cavity, it is bony, and about 2 centimeters towards the pharyngeal side, it is fibrocartilaginous. If we see from the front, like this, right? Like this, if I make structure, one middle ear here and other middle ear here, and this is the roof and this is the lateral wall. Let me draw it. Here is external artery meatus and your beautiful ear. Here is external artery meatus and your beautiful ear with little bit diamonds here if you are a lady. If not, don't put it there, it will bring some unexpected invitations. Okay, now what I'm saying, that eustachian tube exiting from anterior wall, right? This is the roof, this is the lateral wall. Just to make it sure, this is lateral wall. What I'm showing here? Tympanic membrane, right? Malleolar foot. Now, these are the anterior walls. From the anterior walls, eustachian tube is moving like Am I clear?
Yes, sir.
Now, the point which I want to highlight, its initial part is bony, right? Initial part is bony, right? Here also, initial part is bony, right? And distal part is fibrocartilaginous. But truly speaking, this is the cartilaginous part. It's a C-shaped cartilage, right? This thickened area is cartilaginous part. And on this side, this one is fibrous part. What is this?
Fibrous.
This is fibrous. So we can say cartilaginous part is medially, little bit superiorly, little bit inferiorly. But outer area, laterally, it is covered by a fibrous bridging, right? This is one thing. And just to remind you, you remember there was a muscle here which was having a canal, another canal. You remember another canal? What was this canal? Canal for?
Tensor.
Yes, tensor tympani. And this was originating from the canal and also originating from the superior surface of eustachian tube, from canal, and it was also taking origin from under surface of Base of the skull. Yes, you are so good. Right, and here was, of course, what is this? Body of sphenoid and greater wing of sphenoid. And here is your friend pituitary sitting. There's no fun in knowing that. Am I clear? No problem? Here is now where it is opening nasopharynx. Right. Now this view is from the front. Right? Actually, even though I'm giving a lecture on middle ear, but I'm trying to orient development of lot of head and neck areas. Right? Now if you are looking to me like this, we make a section here. What is this section? Sagittal or coronal? Coronal section. We are making at a level, and this section is passing through the soft palate. Right? And if it is passing through the soft palate, then I will draw the soft palate here. You know, you have uvula here. Yes. You know, when I was a student, something very sad happened in my life. For a long time, I kept on reading it, vulva. I don't know why it was happened. Later on, one madam corrected me, you are stupid. I don't know how she knew it. But I said, why you know I'm stupid? She said, it is not vulva, it is uvula. Then I told her, I have discovered in head and neck there's palatovaginal canal also. She got angry. Anyway, she said, you are perfect stupid. God bless her. You know, I kept the secret. I never told someone these mistakes. But she was such a nasty woman, even though she was my madam. She went in the class and told, this is Najeeb was telling in the Viva. Anyway, forget about it. These are what? Don't tell me testes. These are tonsils. These are tonsils. Here is your tongue. I mean the person's own tongue. Right? So now you understand what is this diagram. Now why I'm drawing it? I want to explain function of the tube and some very important muscles related with this tube. Right? Now, number one, the muscles which are going from here to the pharynx. From the tube going to the pharynx. These muscles which are going towards the pharynx, right? These are, I have cut it because I want to show some other muscles also. These muscles which are going to the pharynx, right? Actually they originate from the tube. They take origin from the tube. If this is a tube, and for example, these are my two tubes, right? This muscle take origin from the tube and move downward and backward. From here also, muscle take origin downward and backward. So it is going from the tube to the pharynx. And tube is also called salpinx. So this muscle is called salpingopharyngeus. Very good. So this muscle is called salpingopharyngeus, right? Salpingopharyngeus. This is salpingopharyngeus muscle, right? Now, there's another thing. This is soft palate, and there is a muscle originating from here, and it is going and embedded at the top of the, what is this? Soft palate, and this muscle which is attached with the top of the soft palate. Now you can understand, if this muscle contracts, what will happen? It will pull the palate upward. This muscle will pull the palate upward. Is that right? And of course, this is the other counterpart on the right side. And when both of them will contract, they will pull the soft palate upward, right? So because they elevate the soft palate, so these muscles are called levator. Okay, yes, levator veli palatini. Levator means elevating, elevating. Levator veli palatini. Is that right? So it means if this is the tube, right side of the tube, right? This muscle is going from under surface to backward, salpingopharyngeus. Other is coming directly downward and is attaching at the top of the upper part of the soft palate, and when contract, what it does, it elevates the soft palate. So it is called levator veli palatini. Then there is another muscle. It is taking origin also from the tube, and it comes down and around the humulus, its tendon. Okay, let me draw it a little bit more prominent. This is uvula, okay? This muscle, here is the humulus here of the hard palate. There's a hook here, and this muscle is attached to other structures also, but right now I'm showing only attachment with the eustachian tube. It comes down and then it moves medially in the what? What is this? Within the soft palate. In the same way, a part of this muscle is coming from here, right? And also comes downward, it turns around a hook, and then now this is soft palate, right? Of course. Now listen, when this muscle, both of them will contract, right? When this muscle will contract, it will pull because the tendon is around a, what is this? Hook, humulus, and this is aponeurosis. When this will pull upward, this tendon will be pulled laterally. So soft palate will become tense. You are understanding? If this is my soft palate, from the tube, this is a tube, from tube directly muscle coming, levator, veli palate. Then another muscle coming here and then entering from lateral side, coming here and then entering into lateral. And this will turn upward, there is a hook here, bony hook, right? Around that hook, when they contract upward, they make the soft palate tense. So what should be the name of this muscle? Tensor veli palatini. What should be the name of this muscle? Tensor veli palatini. Okay, so I will tensor veli palatini. Tensor veli palatini. And what was this muscle? Yes? Levator veli palatini. Levator veli palatini. And there was one muscle here. What was this? Tensor tympani. Tensor tympani. These, and of course salpingopharyngeus here, right? Right. Now, what I really want to tell you, that normally eustachian tube is closed. Eustachian tube is lined by mucosal lining. It is having epithelial cells inside, columnar epithelial cells, ciliated cells, right? Ciliated epithelium, columnar ciliated, respiratory epithelium, which extend from pharynx up to the middle ear. But normally it is closed, right? And these muscles, levator veli palatini and tensor veli palatini, when these two muscles contract, they open the tube. Because one is attached to the lateral side of the tube, other is under and medial side of the tube. So when tensor veli palatini and levator veli palatini, when they both of them contract, they basically open the tube. So that is why eustachian tube can be opened during swallowing. Pharyngeal muscles come into action and palate, these muscles come into action, or during yawning, or during when you are, yes, what you are doing. It can be opened. Yes, chewing, right? Now, here when it's very important to know the nerve supply of these muscles, these tensor, what is this? Tensor tympani and tensor veli palatini, both are supplied by fifth nerve. Both are supplied by fifth nerve, right? Mandibular division, right? Trigeminal mandibular division, actually motor part. To be very specific, a branch going to the medial pterygoid also supplies to tensor tympani and tensor veli palatini. So both tensor of the tympani and tensor of the palate, they are supplied by fifth nerve, fifth cranial nerve, of course. And these two, what are these muscles? Salpingopharyngeus and levator veli palatini, they are supplied by, yes, 10th nerve. They are supplied by 10th nerve, vagus nerve through pharyngeal plexus, right? But anyway, right now my purpose to discuss this was that how eustachian tube opens into lateral part of nasopharynx interiorly, and it is lined, it is basically bony fibrocartilaginous tube. Bony part is 1/3, posterior part, interior 2/3 is fibrocartilaginous, and the four muscles which take origin from here, tensor tympani from upper part, and other part of the tube, they give rise to salpingopharyngeus, levator veli, palatini, and tensor veli, palatini. For us, right now, two muscles are important, which are tube opener, right? Number one is levator veli, palatini, another is tensor veli, palatini. Am I clear? Now, what is the really function of this tube? This tube's primary function is that it does the aeration of the middle ear, right? You know, the atmospheric air pressure, right? Atmospheric air pressure is the same which also is in the nose, because nose is open cavity.
Yes.
Do you close your nose all the time?
No.
Thank God you don't have sphincters around it, right? Anyway, so then you have to keep dilators all the time with you. So anyway, so external environmental, why you are so worried? It's not new information. Everyone knows there's no tight sphincters here at least. Okay. So there is external environmental air pressure, right? Then same in the nasopharynx. And if eustachian tube open, the same air pressure will be transferred to the middle ear. So the real purpose of, now we come to another diagram, which I want to make it clear. Here is the, okay. This is the anterior wall, right? This is the anterior wall, and as I told you, on this side, what wall is there? What is this wall? Lateral wall, right? Now, actually here is what? Tympanic membrane. Now, if we look from the top, now I'm going to draw a diagram like this. You cut it from here. What is this section? Axial section, are you sure? Yeah. I feel it's just cut section. Okay. So there's a section here I will draw, and okay, no, not this. Let's make it a different way. We'll put the nose, how should I do? I think this angle, like this, okay? So let me show you what really happens. This is my nose, these are my beautiful ears with leftover hair. You understand these landmarks, right? Now this is external, yes, auditory meatus. And what is here?
Tympanic membrane.
Tympanic membrane. What is this? Tympanic membrane. And then here is masthead system, yes, middle ear, and here is the eustachian tube which opens into nasopharynx. In the same way, here is your masthead system, middle ear, and here is the tube which is going to open into nasopharynx. Buried under it, there should be nasopharynx, which is communicating with the nose, external. Now what really happens? Actually, air is on both sides of the tympanic membrane. This is from the external auditory meatus air, and from here, the air through the nose and nasopharynx from the eustachian tube, air is also here. Air is a very important content of middle ear and also in masthead system. So actually air is present on the outer side of tympanic membrane as well as present on the inner side of tympanic membrane. Normally, physiologically, the air pressure outside and inside should be equal. Yes. The air pressure outside and inside should be equal. If air pressure outside and inside is equal, then tympanic membrane will be free. But if due to some reason, and if tympanic membrane is free, it will oscillate well, right? But if due to some reason, if the pressure outside and inside is not balanced, let's imagine inside pressure is less and outside pressure is more, tympanic membrane will bulge inside, right? It will be sucked inside. If inside pressure is less, do you think then it can vibrate well?
No.
It can oscillate well with the sound energy? No. Or if due to some reason, if pressure inside is more and outside is less, then tympanic membrane will bulge outward. And if it too much pressurized outward, can it oscillate freely with the sound energy? No. So to properly conduct the sound energy through the tympanic membrane should be free to move by keeping the air pressure on both sides of the tympanic membrane equal.
Yes.
Am I clear? Now, this pressure in the external auditory meatus is always the same as atmospheric pressure. But how to keep pressure equal in the tympanic cavity, equal to the pressure in the external auditory meatus or equal to the atmospheric pressure? The nature has designed this tube. What is this tube? Pharyngotympanic tube or eustachian tube. It is connected with the nasopharynx, and whenever it open, right, air will move in or out depending upon the pressure situation.
Yes.
Is that right? And in this way, this tube plays a very important role in aeration of the middle ear and masthead system, and also keeping the balance in the tympanic cavity, air pressure equal to the air pressure in external auditory meatus, and letting the membrane, tympanic membrane, you can say, oscillate freely with the sound energy response. Clear?
That's right.
So this is the basic purpose. Now what really happens? If due to some reason, tympanic membrane become blocked, if due to some reason, and what is the reason? Most common reason is either inflammation. Here, inflammation here may be due to microbiological challenge, infections, or it may be due to allergic challenge to the nasopharyngeal mucosa. So what happens? If inflammation occurs in the pharynx, right, this inflammation can go and involve the mucosa of the tube, eustachian tube. And then eustachian tube, if its mucosa becomes swollen, then it will be closed.
Yes.
Is that right? And it more commonly occurs in children, right? That there is inappropriate pathological, you can say, closure of the eustachian tubes, right? Why it occurs? It can occur due to any inflammation of eustachian tube, mucosa, or nasopharyngeal mucosa where it opens. It may be challenged by microbiological system, or inflammation may be due to allergic situation. And once this tube become inflamed, what will happen? This tube become inflamed, or mucosa become inflamed or swollen, this tube will close. If this tube closes, then what happens? Let's imagine now, if this tube is closed, right, blocked. If this tube is blocked, then middle ear cavity and masthead system, right, they are disconnected with the air in the nasopharynx and of course with the atmospheric system. Then air present in middle ear, if eustachian tube is closed, right, then this air which is trapped in middle ear and masthead air cells and masthead antrum, this air will gradually absorb by the mucosa. And relatively negative pressure will develop in middle ear cavity. And when relatively negative pressure will develop in the middle ear cavity, number one, tympanic membrane will be sucked in. It will be pulled in. It will collapse in tympanic cavity. Secondly, microcirculation of tympanic cavity will be encouraged to release fluid and mucus in the tympanic space. Again, let me tell you. In the tympanic cavity, let's suppose this is my middle ear. This is the, what is this? Tympanic membrane, this side, right? And this is the eustachian tube. Normally here is the atmospheric pressure, and there the also atmospheric pressure can be balanced with the tympanic air pressure through the eustachian tube, nasopharynx, and external nose and external environment. If due to some reason eustachian tube closes, air in the tympanic cavity and masthead system is trapped, and gradually it will be absorbed by the mucosa, and relative vacuum will develop, and then this membrane, tympanic membrane, will collapse in, right, and it will become inappropriately supplanted, and it cannot move freely, right. At the top, mucosa will keep on secreting mucus and other secretions, and gradually this air-filled cavity will become full of fluid. Now fluid will supplant the, what is this, tympanic membrane pathologically, and now tympanic membrane will not be able to move freely with the sound energy. So sound's energy will not be conducted well through the tympanic membrane movement and ossicular chain, and conductive deafness will develop. And conductive deafness will develop. Secondly, such kind of trapped fluid is an ideal environment for bacteria or microbe to proliferate. And now this situation may lead to otitis media, inflammation of middle ear, or even infection in the middle ear, otitis media. So eustachian tube is an extremely important structure to keep the middle ear aerated and keep the balance around, what is this?
Tympanic
Membrane equal. Now this can, number one, result into otitis media, especially glue ear. Let me tell you what is glue ear before I really go for that. These these problems or middle ear infections or middle ear secretions, right, or mucus collection in middle ear, such problems are more common in children than adults.
Okay.
Why? One reason, in children, tympanic, this eustachian tube is very narrow, so little swelling of mucosa will obstruct it. Secondly, in children, this is more horizontal and short. In children, this eustachian tubes are narrow, they're more horizontal, so infection can go backward, and also eustachian tubes are short. Right? All these factors contribute to that children, they repeatedly get not only infection in the pharynx, but also associated pain in the ear or conductive deafness in the ear due to this blockage.